What are some of the most common or most important systemic comorbidities clinicians should screen for in patients with psoriasis? What do you see most often?
Most often is will be the joint disease. So many patients who are afflicted with skin disease will have joint disease as well, and that's very important to address and treat early on because changes in one's joints can be quite permanent if it's not addressed early. Uh, Simple questions that one can ask in clinic is does one wake up with morning stiffness? Are the joints very swollen? Back pain that improves throughout the day? These could all be signs of systemic inflammation and issue in the joints.
How do you practically screen for things like psoriatic arthritis in a busy clinic, and when should non dermatologists refer to rheumatology?
So I like to ask just very simple, open ended questions. Do your joints hurt? Do they hurt in the morning when you wake up? Does it get better throughout the day? Which joints hurt? Are they swollen? These often indicate a psoriatic component in the joints. I believe that once the joint involvement is addressed and there's a concern for that, there should be a rheumatology referral and evaluation. Often, a lot of our medications now that are geared towards skin disease are also treat psoriatic arthritis and have FDA approval indications for both. So it's great when one of my patients come to me because I do feel like I can also start moving that treatment paradigm forward to treat both the skin and joints.
Mm. Can you discuss the link between psoriasis and cardiometabolic risk and how aggressive we should be about risk factor modification in these patients?
Yes. So it's very important to address the cardiometabolic risk and its associations with psoriasis. So psoriasis we know is inflammation, and and we know that there's heart related risk as well. So that inflammation can increase atherosclerotic risk. So we can think about all those vessels around the heart getting inflammation there and there being plaques. And what that can lead to is heart disease. So it's really important for our patients who have psoriasis to also lead heart healthy lifestyles. That includes monitoring one's blood pressure and being on medication if needed, reducing weight. We know obesity is a risk factor for actually both heart disease and psoriasis. And also, we always advise on smoking. So patients should not smoke as again, this is a risk factor for both.
Mhm.